On average, we're seeing the first year after they go through my program is about 210,000 is what I've seen added to a single solo practitioner office. That's if you have about 3 days worth of hygiene. So let's say 50 new patients a month. Those offices are doing over $500,000 the first year. So if you're diving into this and you're doing 6 to 7 appliances a month, which is on the low end, you're going to make a lot of money.
Hello, everybody, and welcome to another episode of the Raving Patients Podcast. First, want to thank the sponsors, both Dental Intelligence and the Doc Site, for their support, allowing me to come to your inbox every single Friday morning at 5 a.m. Eastern Standard Time with a new episode. I also want to remind everybody about my event, Supercharge Your Dental Practice. It will be September 26th and 27th in Fort Lauderdale, Florida, at the Pier 66 Resort, an amazing new resort. It is just ready to open its doors any day now. So it's going to be a brand new resort at my event. We are having a panel discussion at my event on how to basically increase the services that you're offering to a practice, accelerate the revenue. And my guest today is actually one of the panelists on that panel. Today's episode is how to add to your EBITDA. My guest is Dar Radfar from Rad Health, and we're going to be talking about a number of ways that he is able to help you add to your EBITDA here. Dr. Dar Radfar, better known as Dr. Rad, is an international speaker on sleep apnea, snoring, low-level laser therapy, marketing, medical billing, and much more. He's a winner of Dentistry's Got Talent at DICMA and the Best Facebook and Instagram Influencer Award. Dr. Rad humbly captivates any audience he speaks with. So please welcome to the Raving Patients Podcast, Dar Radfar. Dar, thank you so much for joining me today.
Thanks for having me on. I'm super excited, first of all, to be on your panel at your event. Your events have been amazing, to say the least, from what I hear. So excited to share some of the stuff today that we can literally use ASAP in our practices to increase really our bottom line, and also to, treat people in a different way, maybe even in a holistic way, stuff that we don't learn in dental school.
Well, that's the thing. And we go way back. For those that, don't know, I met Dar probably in 2016, maybe, at the CDA meeting, during one of the events I spoke with. He came up to the booth, and he signed up for Bird Eye, and you've been a client for quite a long time. So we go way, way back, Dar and I. So Dar, why don't you, to begin with, why don't you expand on your bio a little bit? Why don't you kind of tell people about your journey from practicing dentist to, obviously you still practice, but things you do now and how you help dental practices?
To have passion and purpose in the field that we do, not just cutting crowns and doing Invisalign and placing implants, those are great services. When you have a personal story such as mine, which is, I fell asleep at the wheel in 2009. I crashed my car into a tree not knowing that I'm a sleep apnea patient. That propelled me to be able to make myself my first mandibular advancement appliance in my own office. I was patient zero in my practice in 2010 after I did a home sleep study. And I realized that dentists are the only humans that can actually do some sort of treatment, and they can actually screen patients just by looking in your mouth line or looking in anyone's mouth, any patient that walks in, or looking at their medical history. I can pretty much guide the patient into a question or a conversation of how well do you sleep at night. I'm noticing that when I was doing your exam and I had you back, your airway looked a little restricted. Now there's ways of doing that and looking for those types of signs and symptoms. And most patients will tell you, yep, I sleep great. But there will be those patients that have already had a sleep study. They can't wear that mask. And so that kind of opened my eyes into and my heart really into helping patients sleep better. A third of our lives is spent sleeping. And if we're not sleeping well, 13 different medical conditions can happen, including mental health issues such as depression and anxiety. And once I started getting into the passion of helping people sleep better, my numbers went up. And my numbers went up. And typically now that when I train offices on how to do this, meaning how to screen, how to incorporate which appliances to use, all the chart notes, the home sleep testing company, the medical billing company, all that, we're adding close to $250,000 the first year to an average practice. And the cost of doing an appliance is about $450 for most of the appliances out there. And the cash fee is about $3,000 to $3,500 that most dentists are charging. So the ROI is there. And let's not today I want to make sure that we aren't shy and not limiting our beliefs about how much money we can make from this, because there is that total health and approaching this from your heart, saving people's lives literally when you treat sleep. But there's also the financials are very rewarding. And I'm excited to talk to you about a little bit about the numbers and also about other things too, such as low-level laser therapy and DNA testing in the dental world, and also supplements that patients can use.
Well, that sounds great, and I'm excited to kind of talk to you about these things. As we mentioned, one of the things I am having at my event is, because my event's all about making more money, is a panel based on how to add services to your practice, which will help with the bottom line. So this fits in well what I talk about anyway. So let's start with actually the reason why I actually asked you on there originally, and you do more than just this, is sleep apnea treatment, because sleep apnea is a very large deal now. The number of people that suffer from sleep apnea are incredible. Celebrities have died because it went untreated. So why don't we talk about just sleep apnea treatment in general? What percentage of the population is affected by it? How do you help determine whether a patient is or has sleep apnea? And then what are the options to treat it in a practice?
So when you have 20 patients on average walking in, whether they're hygiene, crown preps, PO checks, whatever, 30% of those patients are estimated to have sleep apnea. So that's around 6 patients out of the 20 that are walking in that are either A, left untreated, B, have no idea that they have such a thing, or C, they are wearing a CPAP machine. And they're either, unfortunately, the people who do have that mask, about 3 out of 10 of those people actually keep the mask and use it regularly. The other 7 out of 10 who've gone through the whole gamut of testing and been given the mask don't wear it. And so they gave it back to their physician. So there's a slew of patients already within your practice that you all may have taken a course, may be interested in it. The problem is there's no system in place to be able to screen these patients properly. Since 2014, I've taught over 3,500 dental professionals and counting on how to do this. And the biggest problem was on Monday when they go back to work, they have too many things going on to be able to implement a system that they just learn in a 1-day or 2-day course. So coaching is necessary. And that's kind of like what I've been understanding and providing for the last year to practices is take my course online and then learn how to do it and then actually implement it with me talking to you on a weekly and every other week basis for a few months to make sure you're successful. And because we have so many patients already in the practice, the first thing we have to do is get educated and have the team get educated. The team has a 25-minute video that I created, hygienists and staff that just look at the video, know what to look for in the mouth, know what to look for in the medical history, know how to hand it off to the doctor. Then it's the doctor's job to go over the fact that if you are left untreated for sleep apnea, 12 to 15 years off your life, 5 times higher risk of cancer of any kind. 46% of patients is estimated that are depressed is due to the fact that they have sleep apnea and low serotonin production. And I can go on and on and on about all the different other medical conditions. And that's what basically we go over in the course. And so we need to educate our patients that we're doing this, we're providing this once we get the information on how to do it and what appliances to use and whatnot. And that's through emails, just like a simple email that we send out every other week just to say, hey, congratulations, Dr. Rad. We are now treating sleep apnea and snoring in our practice. Come in for a complimentary consult. That simple email usually brings in 5 to 10 people the first month because they are excited to know that there's an alternative and they're not sleeping well. So educating the patients is crucial, and to do that through email, through SMS messaging, and also just the banter, the talking to the patient. Just like if you came in and you needed an implant on your lower left, I wouldn't just let it go. I'd give you your options, right? Implant, do nothing, partial denture, maybe even a bridge. It's the same thing. When I look in the mouth and I look in the medical history, I see certain comorbidities or associations with sleep apnea, such as acid reflux, grinding of your teeth, lower anterior wear, large scallop tongue, high blood pressure, diabetes type 2, history of heart attack, stroke. I mean, I just mentioned a few of the things that we look for. And guess what? It seems like even more than 6 out of 20 patients would come in with these conditions. And that's why it's just open our heart, open our mouth, let them know what we see, let them know the correlations to sleep apnea, and give them the options of a home sleep test and the company to refer to I go over with in my course, so that you can just sit back, let the patient get tested, come back with the results, and fabricate an oral appliance if they're a candidate for one.
You mentioned in the very beginning that an appliance will cost $300, $400, something $100, and then the reimbursement is about $3,000+ generally.
Yeah, so you're looking at a Sleep Herbst appliance, which is my favorite appliance. Gergen Ortho Lab in Arizona makes mine, has been making mine since 2010. I have a couple of them myself, and I've made a few thousand of these appliances. Cost about $440, and my cash fee is very nominal. It's $29.50 cash fee. Medical insurances do cover it. Medicare does cover it as well. HMOs, it's a different beast. I don't even enter that world. So, I always look at the patient as a cash patient, whether they have the best medical insurance or Medicare. We dive into that into my course and how to be able to handle those patients. But just the same way you treat you do Invisalign, you recommend that implant, or the patient's $1,500 allowable for the year has been already maxed in dental. You still provide the options for treatment when there's a broken tooth, when there's a tooth missing, or there's teeth to be straightened. We don't just look at the dental and make our diagnosis and treatment. We look at the patient, and we look at the needs of the patient and educate them. This need is a little bit more, I don't want to call it important, but let's be real. I just went over some of the risk factors of death and cancer and heart attack and stroke and mental health, let alone sleeping next to a bed partner, right? If you're snoring, it's very challenging, especially if it's sleeping for the first time. It's very embarrassing. Or travel and sleeping in the bedroom or a hotel room with a coworker or whatnot. It's very challenging to be able to do these kinds of things when you snore and have sleep apnea. So we got to get out of is medical insurance cover it? Otherwise, I can't do this. No, treat it like a cash patient. Forget about medical insurance for a minute. These patients are suffering. They need our help. We're the only ones who can give the alternative to the CPAP, which is the oral appliance. And unless you want to go the surgical route, we are really the leading treatment providers for sleep apnea.
Wow, that's amazing. And a practice, just take a one doctor practice who goes all in on this type of procedure being brought into the practice. What type of financial increase do you expect from what they are bringing in now?
Yeah, so on average, we're seeing someone who goes all in the first year after they go through my program and I coach them the first few months, and then they go off on their own, is about $210,000 is what I've seen added to a single solo practitioner office. That's if you have about 3 days worth of hygiene. So let's say an influx of patients. That's not even one of those patients that have 50 new patients a month, or those offices are doing over $500,000 the first year. So if you're diving into this and you're doing 6 to 7 appliances a month, which is on the low end, you're gonna make a lot of money. More importantly, I show you how to get referrals from the medical doctors without spending really a penny. And that communication between the dentist and the physician is really crucial to be able to talk that we have mutual patients already. Len, if you were my patient and I looked in your mouth and we did a home sleep study and I did an appliance for you, I'm going to ask to see how many medical doctors have you seen over the last 3 years. You're going to tell me, I saw an internal medicine guy and maybe a cardiologist. I'm going to share that information that you and I discovered together through our sleep apnea exam and through our findings to your medical doctor through a letter called the mutual patient letter. And so now the MDs in the community have heard from me because I'm sharing information about our mutual patients, about what we're doing together. And I plant the seed that, hey, just a little tap on the shoulder. I'm here and I'm ready to help you. And I need your help as well, because I have tons of patients who have trusted me for the last 20 plus years that need a cardiologist in the community, or need a internal medicine doctor in the community, or urologist or endocrinologist or psychiatrist, all the conditions in medicine that are correlated to sleep. And so I build a nice network for the dentists that I help coach and consult over the first few months, so that now you're getting referrals from the MDs because they know about you since you've already serviced some of their patients when you go through your own patient database.
And I think one of the big advantages of it, it's less taxing on the body I know many doctors or dentists, as they are more mature in their practice. I don't want to say old. The more mature they get, the longer they're in the practice. They almost transition from doing clinical dentistry in the mouth to this type of, because it's less taxing on the hands and the back and everything else.
Yeah, I mean, it's so much easier, and it's crazy because when my upper back started to hurt and whatnot, and I'm doing more sleep, I realized that I could give more of the bread and butter dentistry to the associate who's younger and able to do those things, while I do more sleep and Invisalign and ortho and treatments such as Botox for TMJ. And also what I wanted to also go over with you is low-level laser therapy. This is actually great for ourselves for back pain, neck pain, shoulder pain, jaw pain. So I use low-level laser therapy on myself once a week on the areas that feel tight for about 10 minutes. I point and shoot the laser. It's cold laser, so there's no numbing, there's no contraindications, it's valid and used for anyone and everyone. But I use it also on my patients, and I use it for TMD, for tightness of the muscles of the jaw, the head and neck, the shoulder. I use it for post-operative pain reduction. So they have FDA clearance. Erconia laser has FDA clearance on post-operative pain reduction by 45%. So what does that mean? You come in as my patient and I numb you, I take the tooth out, I place an implant, I do SRPs, any sort of dental procedure that has post-operative pain, which unfortunately we do a lot of that. I point and shoot to that area with this handheld laser. It looks like a cell phone, and it's on a stand. And for about 10 minutes, I put it on post-operative pain mode, which is a wavelength that it's set at, and it reduces pain by about 45%. And that's been shown in FDA studies that benefit the patient tremendously. And I incorporate that into my treatment. At $75 a session for TMD, I do 2 treatments for TMD 1 week apart. Or my implants, let's say, is $3,500 for an implant, abutment, and crown, and low-level laser therapy. I'd add another $75 to it to reduce the pain, because it's also promoting healing as well. It's an antimicrobial as well. It has a purple or violet wavelength and a red wavelength. So it has a combination of pain reduction, promoting healing, and also microbiome reduction to have the best possible outcome for the patient. And that's another way of adding revenue to your practice.
What does a laser like that cost?
$15,900 is the actual handheld one. There's another one that kind of goes around and does the whole face and jaw. That's a little bit more expensive. It's $45,000. But it's also billable under medical insurance. Code 97037 is as of January 1st, 2024. Yours truly was one of the first ones to bill for that. It's post-operative pain reduction using low-level laser therapy. And the reimbursements have been anywhere from $200 to $1,200 per session. So if you would imagine, I've already made my money almost threefold this whole entire year just from medical insurance.
Wow, that's pretty amazing. That's pretty amazing. Now, just out of curiosity, because I go to trade shows all over the country, how does this type of therapy differ than the stuff that those companies try to sell you at one of the trade shows, which is the red light therapy as well? Are they similar? Are they different? Is one more powerful than the other? Talk to me about that, because that's where I'm most familiar with seeing these things for sale.
Yeah, first of all, this isn't red light therapy. This is an actual laser therapy that is approved by the FDA to be able to reduce pain and reduce microbiome. So it's not just a red light therapy to help tighten up the skin or anything like that. It's an actual medical device that has FDA clearance. That's why it's billable under medical insurance for postoperative pain reduction. So, and it's not a burning type of device to lower microbiome when you do SRPs or deep cleanings or whatnot. So you don't have any sort of let's call it clinical hindrance in this. Any assistant hygienist or dentist can point and shoot in the area and do the work to be able to reap the benefits. The wavelengths, there's tons of different frequencies you can set the wavelengths at. There's one for TMJ. There's one for postoperative pain. There's one for stimulation of bone, reduction of fat under the chin to help with sleep apnea, soft palate, tightening when it's pointed to the back of the palate as a patient's biting on a bite block. I mean, there are so many different wavelengths and frequencies this can be set at. It's customized. It's not just one red light frequency or wavelength. It's a totally different application. And the way it works, Len, is it stimulates the mitochondria to produce more ATP. And when you produce more ATP, that's the powerhouse and the energy for the cell to promote healing. It has an opioid effect, and it basically gives you a much, much more better prognosis on anything that you do in dentistry.
Wow, it's pretty impressive. I know you have another, or we talked about this, something newer you're working on, or you've just released some DNA testing as well, that will provide a whole panel of ideas or issues that someone can find out about themselves. Can you talk a little bit about that as well?
Yeah, so I've dived into Rad Health, my brand and product line during COVID, one of the blessings that came out of COVID. And Rad Genes is basically a cheek swab testing kit that I use on patients now. I just launched it a couple of weeks ago, and their offices are already super interested to incorporate this into their practice, because per kit, each dentist will make about $100 every application or every patient. But what does it really do? It gives us 10 biomarkers for patients that are, let's call it, inclined to understand more about their DNA or genetic makeup. For example, if you want to know if a patient has mercury sensitivity and they're wondering if mercury is a bad thing for them based on their biomarkers, this will test for that, which ultimately would lead to an action plan of a chelating agent to remove the silver mercury fillings with the dentist. So there's going to be recommendations based on the results that come back for the patient on the patient's dashboard when they log in to their RadGene portal. And so there's another one is nickel sensitivity, PFMs, partial dentures that are made with metal. If a patient has nickel sensitivity as a biomarker, they should be recommended to be able to remove nickel from their mouth and what they're using, such as a partial should be changed to a Valplast. So that's a couple of them. Oral cancer is another one. HPV virus. Teeth grinding, there are biomarkers for teeth grinding. I mean, how amazing is that to be able to know if the patient has a genetic predisposition? And so there's ways and solutions to be able to help these patients to have a biomarker for gum disease, for enamel matrix, how strong their enamel is genetically, for fluoride sensitivity. So all these things are really crucial things in dentistry, jawbone density, to know these things, to be able to see if a patient's a better candidate for an implant or not, or to take supplements, or to go to hydroxyapatite as opposed to fluoride if they have a fluoride sensitivity. These biomarkers are crucial in what we do. If you have, Len, the gingivitis or gum disease sensitivity, the action plan is going to be definitely, you're going to need a water flosser, you need a electric toothbrush, and you'll definitely need some sort of oil pulling to be able to help as well. And also 3 to 4 month checkups, perhaps, not 6 month checkups. So the dentist has an opportunity to not only make money from the kit, but also to get ahead of the 8 ball and to be able to really proactively educate the patient on really what needs to be done within their own practices to be able to guide the patient to better oral health.
That's pretty impressive. Just those 3 things. Now, I know that you mentioned your line of products. You also have supplements as well that you have, correct, as well?
Yeah, so RadZ's was my first supplement. It was a supplement that was created for sleep apnea and insomnia during COVID, when everyone's like, oh, the mouthpiece is great. I sleep fine when it comes to no snoring and I'm breathing fine, but I can't shut my brain off. So I'm taking marijuana gummies, I'm drinking alcohol, I'm doing Advil PM, Xanax, and all that. And I said, wow, this has really become a problem. People are having a hard time falling asleep, more anxiety, more stress. So I developed RadZ's. It has ingredients such as valerian root, L-theanine, N-acetylcysteine. N-acetylcysteine, if you Google NAC sleep apnea, you'll see it reduces sleep apnea by 30%. So that was my first supplement. It's $30 for a month supply. Then I developed a jaw supplement for TMJ for clenching, grinding, popping, and clicking. It has 7 all-natural ingredients in that one that helps reduce muscle tension and helps internally build the cartilage in the bone that's been deteriorated. I have a Rad Fresh is my number one product right now. That is a spray that cleans sports cards, Invisalign, dentures, retainers, sleep appliances. The NFL is using it now. I have 8 teams on the sidelines in the NFL that spray their sports cards. They get super dirty and disgusting. I mean, how many times do we have those mouth guards for our kids or for ourselves that play football or jiu-jitsu or boxing or wrestling or anything like that, or hockey? And they're disgusting. And it's super easy to clean. Just a couple sprays, it kills the bacteria and the fungus. So I've dived into these products. These products are available for dentists to be able to have at wholesale into their practices so that they can also generate or make any sort of revenue.
Well, that's impressive. The whole, how you kind of connected the whole brand and have really given a huge increase to the bottom line. I mean, it sounds like, look, somebody may only go with one thing, but there's obviously a lot of options you have. And they all make a nice amount of money for the practice. So, that's really impressive. Any other topics that you wanted to discuss before we switch over to our lightning round Q&A?
Yeah, the biggest thing is, if you want to add revenue to your practice, you've got to learn and take some risks, right? And what are the risks? You don't buy any more equipment, just learn the process, like sleep apnea. Anyone here who's interested, we can see if we're a candidate for each other to be able to help you grow your practice and do it right finally, not just take that course for the 4th time or 3rd time and not really implement the system properly. And other services such as Botox for TMJ, man, that has really been skyrocketing in my practice. I probably do about 15 to 20 patients a month now for Botox injections in the masseter and temporalis, and such an easy procedure to do to help patients clench less so that ultimately they can not break their teeth and the restorations that you've done for them and suffer and get migraines and pain. And all you do is give them a hard, soft night guard or and hopefully you're evaluating their airway, because a lot of the people who clench and grind their teeth is due to airway issues. So first it's airway. So you got to get the knowledge, dive into it. Nowadays it can be all done remotely, through Zoom meetings and through online courses. You don't have to spend time away from your practice or from your family to be able to learn this stuff. Although coming to your conferences, I've learned a lot, and I'm looking forward to the one in September.
Well, that's great. So what we'll do is, before we get the way that people can reach out to you to find out more about how you can help them with your products and your classes, we're going to switch now to a fun section for me, which is the Q&A. These are all business-related questions. We'll try to get through 8 to 10 of them in the next few minutes. From your perspective, Dar, just answer them, pretty short answers. You don't need to go into long, drawn-out answers here. That's not the purpose of this. First question: how do you define success?
So for me, success is once I provide myself with a goal, I achieve that goal. Now that success does not necessarily have a financial basis behind it. It's even task oriented. If I can finish my task and, most importantly, be present and enjoy the journey that I'm going through, not just it's a hard thing to do, then I deem it successful.
Okay, which 3 adjectives describe your strengths?
For sure, energetic. I have a lot of energy to be able to get stuff done. I have a passion to help humans, and most important, to help my fellow dentists and hygienists that we're all in this together. I love seeing everyone at conferences and chit-chatting about personal life and personal development. And I guess if you could call growth, I'm a very growth mindset. I do believe in leading with compassion and leading with integrity and understanding, even towards the opposite type of mental behavior or thought process. I have compassion for people now more than ever. I try not to judge as much anymore. So I would say those are the 3 adjectives that have really made me be more at peace.
That's good. I like those answers. Do you have a favorite business podcast?
Yeah, Diary of a CEO is pretty good. I've had some good, I've learned a few things. And the Huberman Lab has also helped me kind of come up with products. The Rad genes came out of that because Dr. Huberman talks a lot about different types of things that you can do to get better health, whether it's walking, in the morning and doing get some sunlight in your eyes, to supplements such as magnesium glycinate to help you sleep better, which is in my sleep product and in my TMJ product. So those are the kind of two that I've really, really been listening to more often.
Got it. All right. What habits have helped to make you successful?
Definitely taking care of my physiology first. Working out 3-4 days a week, going on walks after every meal if I can. If you're not moving, you're withering away. Your brain will work faster, better, stronger. You'll have more energy for success when your body is actually moving. And you've got to create at least 30 minutes a day to some sort of physical activity, whether it's sometimes I'll get on the phone. For example, I'll get on the phone with you and I'll be in the kitchen for 15, 20 minutes and I'll just walk around my island while I'm having a phone call or any sort of conference call. So constant movement, lifting weights 3-4 days a week is a must to be able to function and mentally for me.
Makes sense. What is the number one tactic that you use to stay organized?
First of all, we need more time, right? To everyone, but everyone gets the same amount of time. Whether you're Bill Gates or Oprah or me or Len Tao, we all have the same amount of time, right? So it's organization is a must. My Google calendar is a constant. I make sure that I even put in there things that I need to do for personal reasons. I use Evernote. Evernote's been kind of my new thing to be able to put my tasks in, so I can look up things really quickly so that I don't have to go search for them in my emails or in my texts or whatnot. So Evernote's been kind of cool. And of course, Google Calendar.
Got it. What business related book has inspired you the most, or what is your favorite book?
To be honest with you, I've read so many books or listened to so many books. They all have given me some, Think and Grow Rich was one of the first ones. I think that really was powerful for me. I pick up something from every little thing that I read. There's way too many to say which one I like the most.
Who has been your greatest inspiration?
Yeah, without any sort of arrogance, it's the ability to look at myself and think that I am my own inspiration. I am my own source. No one is here to help me. No one is here to help you all. To actually implement and take action. You should be your own greatest inspiration, your greatest source for love to yourself, acceptance for yourself and who you are. And if you don't like something within yourself, it's about for you to be able to change it. So it's not Tony Robbins, it's not Mother Teresa, it's not anyone on the outside. It's me, myself, and putting some sort of boundaries and educating myself on how to become the best version of myself.
Great answer. When you were a kid, what was the first thing you wanted to be when you grew up?
I definitely wanted to not struggle financially. So to me, I looked at becoming any sort of doctor to be able to provide. That was really the number one thing. I never realized that in 22 years of being a dentist, how much I love the relationships with most of my patients. It's the one profession that we see the mom, the dad, the coworker, the kids sometimes, the brother, the sister, and we see them 2 to 5 times, 10 times a year sometimes. And it's so cool. There's no other profession that I know out there that you see so many different people so frequently and you build a relationship. Dentistry is hard. Staffing, 1 or 2 patients a day aren't liking what you do for them. The other 90% love you. There's so many things from running a business, but that banter and relationship with my patients has been the one thing that I was always looking for since I was a kid. I never realized I was such an extrovert, and that has been kind of like the passion and purpose is that relationship, and dentistry has allowed for that.
That's great. Last question: what is one subscription, either personal or business? So one subscription that you cannot live without.
Man, I would say if you can join a mastermind or any group, I call that a subscription because you're constantly maybe monthly meetings and whatnot. Do it. Get to the finish line faster. Put yourself around people that you can model and who have already figured it out, have done the years of work and research, and you can just talk to them and banter and I use YouTube as an example, as a subscription, because I get to go on there and listen to podcasts and talks that 30 minutes to an hour that would take me maybe weeks and months to understand. So join a mastermind, join a group, and that is the fastest way I think you can get to the finish line of the task that you want to achieve.
How can people find out more about your services, your teachings, everything that you offer?
So you can go to radseminar.com and just send a message if you want to learn a little bit more about the coaching, consulting for low-level laser therapy, for sleep apnea implementation, medical billing, all that stuff that I teach and do. I'd love to share what I do with and how I do it so that we can increase revenue for your practice. You can also email me at my name, Dar Radfar @gmail.com. And my products and whatnot are on my website, radhealthinc.com. Have all my products that you can go in there and take a look.
Well, this was great, really good information. So for those that are listening, he kind of went through 4 ways to basically help increase your bottom line, make more money. Sleep apnea, if it's something that interests you, obviously, he says, that if you think about it, it's approximately $3,000 per patient. Your margins are huge on that for a $450 lab bill plus time and materials, obviously. But it's great. If you have interest and you want to learn more about what Dar can do for you, please reach out to him. He supplied you his website. He supplied you his email address. So you can reach out to him if you have any questions, learn more about his seminars as well. He'll be at Supercharger Dental Practice in 2025 as a panelist on ways to help increase your bottom line. So this is a perfect way to kind of talk about that. I want to thank the sponsors as well, both Dental Intelligence and the doc sites, for their support. And as I end every single one of my seminars and podcasts, webinars, everything, remember, your reputation matters. Until the next episode, Dar, thank you so much for joining me today, and we'll talk to everyone soon.
Thanks so much, Len.